study was botched, and now we can only hope that more parents will choose to vaccinate their children, and this will help to eradicate a lot of childhood diseases.
Hi, I'm Angela Sarah. I'm a licensed pharmacist, and I specialize in immunizations.
The 1998 study by Dr. Andrew Wakefield greatly influenced people's opinions towards vaccines in a negative way through the hypothesis that vaccines cause autism. In early 2011, the study was discredited due to it being a botched study. I'm curious as to how it was held credible for so long.
The Andrew Wakefield study interested a lot of parents and, I believe, healthcare providers looking for answers for autism. There didn't seem to be any other theories that were as strong as the vaccination history. So I think people really were hoping that this could possibly be a cause. Therefore, maybe without vaccinating, or maybe their child could be treated better. I just think parents were looking for an answer, like an environmental factor, versus maybe that this is some type of genetic problem. So until something else comes out, possibly parents will still maybe cling to this cause, even though the Andrew Wakefield study has been pretty much totally discredited.
According to the Center for Disease Control, a vaccination is an injection of a killed or weakened infectious organism in order to prevent the disease. I was interested to hear how this study attempted to link vaccinations to autism.
I believe that Wakefield study talked about mostly that there were 3 live viruses in one vaccine, the MMR, maybe that being like too much of a strain on the immune system. There's also been thought about preservatives in the vaccine, one namely thimerosal, which is like a mercury type preservative, and possibly that could attribute to the autism.
I was hoping to learn about a first-hand experience of a patient that is related to the myth that autism is caused by vaccine. I found this story to be quite interesting.
One example comes to mind, a mother of 4. Her first 3 children were vaccinated. The oldest 2 children that were vaccinated are perfectly fine in development. Her 3rd child that was vaccinated was diagnosed with autism at about 3 years of age. The psychologist group that diagnosed the child felt strongly that vaccines could have attributed to his condition. After that, she was then expecting her 4th child, and she chose then not to vaccinate this child. So as he did develop, he also was diagnosed with autism, and he was exposed to absolutely no vaccines. That seems to show, too, that the parents are not vaccinating their children. Autism's still on the rise, and also these childhood illnesses are on the rise. So this is a problem.
Since rates of vaccines are decreasing, it is only natural that diseases that the vaccines are meant to prevent would be on the rise. I was curious if this claim is true, and if so, how significant it really is.
There are studies that show that childhood diseases are on the rise. One especially that's growing greatly is pertussis. There are several deaths each year from pertussis. These diseases were almost totally eradicated. Now we see them in the hospital where I work. We do have cases come in to the emergency room, which maybe 10 or 20 years ago you just didn't see at all. So it's a problem. We need parents to become better educated on autism, and that vaccines truly aren't linked to this condition. Hopefully we can get children vaccinated more often so that we can cut down on these childhood illnesses that are preventable.
I wondered if there was a belief that there was any correlation between the drops in vaccination rates and the increase in occurrence of childhood diseases.
Parents who are not vaccinating their children because of this myth that vaccines are dangerous and attribute to autism is becoming a problem, and it's definitely why we're seeing more childhood diseases occurring every day. So hopefully, now that the Wakefield study's been discredited, hopefully parents and providers, we're going to really push to get these children vaccinated so that we can cut down on some of these preventable illnesses.